Hi, everyone. Thank you for joining us tonight for actually our last webinar in our series celebrating Pulmonary Hypertension Awareness Month. So tonight we're going to cover topics around the NIH, how to navigate that site and other similar resources, as well as, talk about some other important things around this topic. So excited to have you with us. Before we get started, we will have time for Q&A at the end. So just a quick note, please use the Q&A box at the bottom of your toolbox. Your toolbar. Please put your questions there and not in the chat. That way we can know all your questions and sort through them easily and make sure that we get them answered. So yeah, I guess that's it. So we can go ahead and get started. I'm going to hand it off to Dr. Scott Visovatti.
Thank you, Katie. My name is Scott Visovatti. I'm the director, I should say the medical director of the Pulmonary Hypertension Program at The Ohio State University. But there are so many team members that we will introduce you to soon. This is where we are to the left of your screen, but I would say this is who we are to the right of the screen. This is a picture taken at our recent PHA pulmonary hypertension walk. And this is a great activity that is supported by two of our members here tonight, Debbie and Tiffany, who will introduce themselves very, very soon. So our topic is getting involved in PH research, navigating the NIH website and other resources. Thank you all for joining us in celebration and support of Pulmonary Hypertension Month here in November. And we are just so honored to be part of this celebration and just very honored that Team Phenomenal Hope has invited us to present this topic to you. So here are our disclosures. Debbie Kittel has a few that do not in any way affect the content of tonight's presentation. So here is the overview of what we'd like to talk about tonight. We'll give you some introductions, introduce you to our team members. We'll talk about the types of research very briefly, address the issue of really why get involved in research, things to think about as you're looking for a potential research trial, and then how to actually go about using the very powerful NIH website. And then we certainly want to empower you to ask your research team some questions, some very important questions about any research trial that you might be thinking about getting involved in. So I'd love for each of our team members to introduce themselves briefly and talk a little bit about their background. So Tammy, would you talk about yourself, please?
Okay, I am Tammy Keefer. I'm a former PAH patient. I was diagnosed in 2017. I was able to participate in a drug trial. One of our other participants here was the one who administered all of it for me. I am now a post-transplant for a double lung transplant, so I no longer have PAH, just other issues.
Thank you, Tammy. Tiffany, please introduce yourself to us.
Hello, I'm Tiffany. I was diagnosed in 2020, so right in the middle of COVID. I am a huge, what I like to consider patient advocate. I co-lead our local support group with Debbie, and I organized the national walks. We just had our third one, so I started that 3 years ago, and it is a huge success, and we are very proud of that. And I have not done any research trials because my meds are constantly changing with titrations, so that's something that I'll get into a little bit more later.
Thank you. Debbie, please introduce yourself.
Hi, I'm Debbie Kittel. I'm the nursing program manager for pulmonary arterial hypertension at The Ohio State University. I've been in this role 8 to 9 years. And both Tammy and Tiffany were patients in our practice. And like she said, one has participated in research and one has not been able to. So we should be able to gain a lot of insight into getting into trials and some of the pitfalls and pluses of the trials. So I'm excited to be here. Thanks.
Thank you. Jen, please introduce yourself.
Hi, my name is Jen Smith. I'm a research coordinator at Ohio State with Dr. Visovatti and the PH team. I'm a nurse by trade and background, and I started doing research in about 2007 and have just loved what I did and continue doing it today.
Thanks, Jen. And I'm Scott. I've already introduced myself. So let's start out with a brief overview of the types of research. There certainly are clinical trials, and these can be either sponsored by industry or by researchers, perhaps researchers at your own institution. We'll talk a little bit about the phases of clinical research. Most of you will be approached to participate in phase 1 through phase 4 trials. A lot of effort has gone into developing potential therapeutics in the laboratory, but most of you will be approached once promising options have reached the point of being trialed in humans. More than we can really go into detail today, but I suspect that a good number of you will be approached about phase 3 clinical trials. By no means is that the only trial that you can search for on the website. Certainly, those of you who are on medications might be approached to participate in registries or trials that continue to explore the long-term effects of medications and their side effects in phase 4 trials. Phase 1 and phase 2 trials are much smaller, but those may be options for you as well. I also want to point out that clinical trials are not the only options. Very important to our understanding of pulmonary hypertension, what we call the natural history, or how the disease progresses over time, in addition to who's at risk for pulmonary hypertension and how people respond to therapies. Much of our understanding of all of these important issues come from participation in registries. These can be specific to your own institution, or these can also be national or international registries. These, again, gather information over generally a long period of time. So while most people think about clinical trials and medications when they're thinking about research options, it's really important to realize that there are many different ways to get involved in research. So an important topic, why get involved in research? Well, many of you are most likely on medications for pulmonary hypertension and probably for pulmonary arterial hypertension or pulmonary hypertension related to interstitial lung disease or pulmonary hypertension related to chronic blood clots in the lungs. And we owe the individuals who have fought this disease over the last 3-4 decades because it's because of them, of you, that we now have close to 15, 16 different therapeutic options. This is a very famous timeline from Dr. McLaughlin that I have taken the liberty of extending because we have had, just in the last couple of years, some very powerful new options for treating pulmonary arterial hypertension and pulmonary hypertension related to interstitial lung disease. So I just want to emphasize that none of this is possible without patients who are fighting the disease, working with their clinical trial teams. So certainly continuing to extend this timeline further to the right with new options, that's an absolutely great reason to become involved in research. But I think it's important to think about the individual. As altruistic as people are, as all of you are, it's also important to think about how research affects others. So certainly, or how research affects you. So again, I'm sure everybody would certainly like to help others fighting this disease now and in the future. And this can be involved in research trials that investigate new medication, new technologies, such as implantable devices that can measure pressures continuously in the pulmonary vascular tree, but also procedures. There are procedures that have looked at basically looking at ablation, which is using low-level energy to basically cut veins that might control some of the blood pressures in the lungs. There are procedures to basically actually create a connection between the two sides of the heart to try to offload the increase in pulmonary pressures. So not just medications, but technologies and procedures. I also want to point out that some very promising technologies involve wearable devices where folks can be monitored, their heart rate, their blood pressure, their oxygen saturations can be measured from afar with many of these technologies. So many different therapies are being investigated with trials. And as I mentioned, other reasons to become involved in clinical research really have to do with helping us learn more about pulmonary hypertension and the various groupings within PH. We want to know more about who is at risk for PH. How do people respond? And something that's been emphasized in the last few world symposiums on pulmonary hypertension, how do we better describe the risk for each individual? Not just a risk based on a grouping, but your particular individual risk. How do we predict where you're headed? How do we predict how aggressive to be with your therapies? These all come from registries. Certainly, it's important to acknowledge that becoming involved in research gives you access to new therapies. And I would say that any reputable pulmonary hypertension center is only going to offer clinical trials involving therapies that are promising. I think there are so many levels of vetting various therapies that we're approached all of the time by various pharmaceutical companies saying, "Hey, would you be interested in participating in this trial?" We only do that if we think that this is a promising therapy. Another reason that people might become involved in research is this idea that you're going to be followed more closely, even if you have and I'm sure you all do, the best clinical team for pulmonary hypertension. Adding those additional research visits, adding the additional metrics, meaning the ways that we monitor how people are doing, that appeals to many people, knowing that they're going to be followed so closely. So Jen, could I put you on the spot here a little bit to talk a little bit more as a research coordinator? When you talk to folks about a trial, what are some of the reasons that you've heard, other reasons that you may have heard about why people might want to become involved in your trials?
I think people like to be involved in trials. A lot of the time, I do hear that's people want to help other people, and we wouldn't know we wouldn't have the medications today unless there hadn't been clinical trials. And a lot of people do really like the additional follow-up because they're followed a little bit closer by the team, and some find that more comforting for them.
Yeah. And Jen, I have to say, I may get to spend 30 or 45 minutes with a patient, but then if they're participating in a trial and that that visit on that day is also a clinical trial visit, you spend at least that much time, if not 2 or 3 times that amount of time. Could you speak? I've seen you spend an entire day with individuals.
Yeah, depending on the study and what's required at each visit, we, like I said, specific to protocol, it may be something as simple as questionnaires, or there might be blood work or different imaging or 6-minute walks. So it varies by protocol. Some would just be a phone call. But depending on the trial and what visit you're at, yeah, it can be, I've had some visits last several hours.
Yeah. Tammy, could you speak a little bit to this? Why did you tell us a little bit about the clinical trial that you were involved in, and tell us why you became involved?
I was in the trial for sotatercept, and the drugs that I had been given did a good job, but it wasn't enough. And if I was qualified to do it, if I didn't do it, that's one less person to get this drug approved. And we need them. We need the drugs desperately. So I was willing to do it. Part of it has to do with I had the time. I'm also older. So I don't have young children to raise. I don't have 50 years ahead of me. So if there were some issues, it was a little less serious to me than I think it would be for somebody who was younger.
Yeah. Tiffani, were you approached about clinical trials?
So I actually have not been because my titrations change so often, um, that I've never been approached.
Yeah. And we'll talk about that in a little bit when we discuss sort of other things to keep in mind. Well, let's go to it right now. Tiffani, so how did that make you feel? You've certainly been part of a large academic program where no doubt you had heard about clinical trials that were going on.
Mm-hmm.
Um, you've got a wonderful provider, a group of providers.
Yeah.
What what were you feeling when you were basically kind of maybe asking about research, but told that
Yeah.
you
So
weren't a
I
candidate?
ask. I ask all the time because I'm interested in it. I'm always willing to try new things. I'm constantly bugging Debbie about like what's going on. Is there anything I can do or try? And s- there hasn't been because like I said, I'm constantly doing so much. And it just makes me feel like I'm not good enough. Like my what I can offer is not good enough because even though, you know, my titration is kind of all over the place at any given point, I still have a very progressive form of the disease and I still feel like there are things that could be learned, you know, through me. And so I wish there was a different way of doing it. I wish that it wasn't so strict on, you have to be on your med routine for, however long it is. Um, because I do feel like there are people out there who, you know, who are willing to do it. We're just held back because we're changing our dose, so often.
Mhm.
So like I've almost hit the time. Like I've been within like a couple of weeks and then I'll have to taper down a little bit on something and then I start all over. Um and it just, I'm sure there are a lot of people out there who want to help, who want to do the trials, but like me, they just can't because of the titration.
Yeah. And that's a really important point that we'll come back to. One of the really exciting aspects of research in pulmonary hypertension these days is that most of these trials are testing the additive benefit of one medication or one procedure on top of what's called background therapy, meaning it would be unethical to not treat a patient with, let's specifically address pulmonary arterial hypertension. We would never have anybody not on any sort of therapy. So we're talking about therapies that are added on top of FDA approved and guideline recommended therapies. And so because of that, the background therapies do have to be stable. We can't be up titrating doses, or in most cases, we can't be up titrating doses and then enroll somebody in a clinical trial. And you bring up a really great point, Tiffany, which is we know that we need to be aggressive with this disease. And so many providers are pushing to constantly increase doses. But what does that mean for somebody's um, um, basically their ability to participate in a trial? And we'll come back to this.
Another problem along the same lines is often patients walk too far. Their 6-minute walk distance is too advanced, so they're not sick enough, so they say, to be put in a research trial, when really, I mean, they're very sick and it is a progressive disease, so you don't know when it's going to turn and go south. So there are just some limits to the criteria that they use. I know Tiffany also, her walk distance was too far for her to participate in some of the trials. So,
and to kind of, sorry, Scott.
No, please, Tiffany.
To kind of piggyback off of what Debbie said, all of us patients go into that 6-minute walk with the mindset of, I'm going to crush it. I'm going to push myself and I'm going to crush it today. I want to beat my last one. So we're kind of, in a way, setting ourselves up for failure, because then we're going in with this mindset of, I'm going to crush it, I'm going to do so good, but then we're doing too good to qualify for research. So we've got to like back our minds down to not like overdo it so that, you know.
Yeah, that's really, really important. We'll come back to that in just a minute. So there are some very helpful websites. We've touched on a couple of topics having to do with why you might want to become involved in clinical practice, but we are going to spend some time with the NIH search engine, but I also want to point out that the NIH provides an incredible website that addresses this very issue in some more detail. Why should I participate in a clinical trial? And off to the left, you can see some other topics that are covered in great detail. There are videos on this website. It is just so well curated, so well populated with helpful information. So things we can't cover today, please explore this website, and these resources will be available to you, the links to the websites. The Pulmonary Hypertension Association also provides excellent background on clinical trials, registries, and gives wonderful thoughts about why you might want to become involved in research. We will include a link to this website as well in the supplemental information. So part 3. So you've been thinking about becoming involved in clinical trials. But what are a few more things to consider? Certainly time commitment for the trial. When we were prepping for this, Tammy and Tiffany were very helpful in talking about this concept of overextending oneself, giving limited energy effects on the body. That is so important. So I want to pause here. Tammy, what were your thoughts about becoming involved in sotatercept? And how much time did it take? What toll did it take on you and your body?
They were able to piggyback my appointments with the appointments I had normally. So I didn't have to make extra trips down. I lived just inside the area where they would compensate for travel. So I did not get any compensation for that. So piggybacking those appointments was really helpful. But the time commitment was, not only did we have double appointments, and like Jen had said earlier, some of them can be longer than others. We also, on this particular drug, had an hour wait for it to be prepared. And that hour was not always just an hour. Sometimes it was longer. So it made for a whole afternoon at the hospital. And a lot of that time just waiting.
Yeah.
It did happen to be a drug that gives you more energy and very quickly, which I felt. And once we started doing the pressures, they had improved so much that we kind of were assuming I was on the drug. We didn't know. If I had not had improvement, it would have been harder to do because of the wait times, because of the constant trying to, my job is to monitor myself constantly so that I can share anything that changes. Well, things change all the time in your life. So that's a little bit hard to do, but you got to pay attention to it and you got to do it. So having results made it easier to participate. Now, I did in this trial, they had limits on how much of the drug could be given. So you could get a full dose or half dose or none. And I did have a situation where they needed to lower the dose. And so there were times when I didn't get the full dose or I didn't get one at all. And that was frustrating, but there was nothing I could do to change it. So I just had to go with it. Unfortunately, after 1 year, my PAH reactivated to a larger degree. I had to leave the trial because they needed to adjust my other meds. So, but I did go back on it after it was approved because I had been stable long enough and they could adjust it more tightly according to my test results.
Thanks for that, Tammy. And we've talked a little bit, Tiffani talked a little bit about this idea of, you put yourself out there. You've said, yes, I agree to be evaluated for participation in the study. Do you feel rejected if you're not included? Tiffani gave some wonderful thoughts about that. And then Tammy, you talked about this concept of, gosh, you're monitoring yourself. How do you feel? What if you don't feel any different when you've started a therapy? Does that mean you're not on the medication? Well, folks who are on placebo, as it's called, are every bit as important and integral to a clinical trial as those who are on therapy. We really need to be able to compare folks who are on and not on therapy, and what toll does that take on you? So let's talk a little bit about how to find a clinical trial or registry. We all agree that the best resource, or at least the first resource, should be to talk to your local team. Again, many of you are at PH centers or centers who are closely affiliated with a PH center. There's a lot of the vetting process that goes into selecting clinical trials that are going to be presented to patients at a local program. So the best option is to ask, hey, what am I eligible for? And both Tammy and Tiffani did this. Other options include smaller research endeavors, such as the research room at the Pulmonary Hypertension Association conference every 2 years. This can be as simple as a one-time visit, a blood draw, maybe some other information contributed to research programs. So there are local options that are best explored initially. But if you want to expand your search, and we want to empower you to do that with today's webinar, there really is no better option than the NIH website.
But while you're pulling that up, Scott, at larger centers like Ohio State, Jen is our research coordinator, and she screens every patient who comes to every one of our PH clinics. And so that way the physicians are aware what studies or research trials that each patient would qualify for. So we kind of have an advance notice, and that is very helpful. It just is a good reminder for us to then approach patients and see what we think about the trial and if they would be a good fit. And then we would just refer them back to Jen to talk to the patients about it. So if you have that option at your institution, that's a great way to get involved in the trials.
So can everybody see this now?
Yes.
Okay, great. And again, we'll have a link to this in the supplemental information. So very easy website to navigate. You can type in your condition of interest. Pulmonary arterial hypertension is what I chose here. One could even choose something as specific as sotatercept. And then you can search by your city. The nice thing is if you search by zip code, and I used my hometown 60601, Chicago, Illinois, that gives you the ability to expand or contract the radius of the clinical trials that it will report to you. So let's be broad here. For example, 140-mile radius, and you search. And here's something that pops up. So a study to evaluate sotatercept in children with pulmonary arterial hypertension. Now, the nice thing is there's a nice long list of options here most times. It will tell you if these trials are still recruiting, if this trial has completed, or sometimes active but not yet recruiting. Different sites come online at different times. So that's important. Maybe your local program isn't yet active, but you want to explore the option of getting involved right away. You can certainly do that with this. So in this situation, giving our radius of 140 miles, it shows that there is an option to participate in Milwaukee. If you click on this, you can learn a lot about the sponsor, meaning the pharmaceutical company that is sponsoring the trial. Often quite detailed information about the medication itself or the therapy itself. And oftentimes a global or more expansive contact person to learn more about the trial. In other words, you could call this phone number and say, hey, I'm in Chicago or Minneapolis. Where is the closest place where I could become involved in this trial? And it will show you all of the places and whether they're recruiting or not. Some are very specific about specific people to contact. Others are more general, but it's really nice to be able to see where people are in terms of the recruitment. And again, we talked about Milwaukee. That was closest to us, but if you wanted to use a map option, this is really nice, and it will give you the graphical representation of where these clinical trials are being offered. If you wanted to look at a number of options, you can just start clicking boxes, and you can actually save this search to your own, usually an Excel web sheet. By clicking the CSV, which is the nomenclature used for Excel. And then you can kind of include some more specifics about which of the trials you'd like to download and then maybe look at later. The other things to think about here are maybe being less specific. Maybe we don't even want to search for sotatercept. We just want to search pulmonary arterial hypertension. And we're getting a lot of trials that are either completed or active and not recruiting. But you can be very specific and say, only show me those sites that are actually recruiting for this specific condition. And it may be that, yes, sotatercept is the current buzzword, but you'd like to know a little bit more about other options that are being investigated. I want to point out the fact we've talked about how important registries are, and registries do show up here as well. This is a very important global registry, and you can see all the different areas, all the different study sites that are recruiting for the Pulmonary Hypertension Association registry. So I just want to bring that up to folks. There'll be more information, again, in our supplemental information. But I also want to point out that even after you've found a trial you might be interested in and maybe reached out and contacted the study team, either locally or from afar, there are some other important questions to ask yourself and to ask the team. Here are just some of these. Tammy, what did you ask your clinical team about when you were becoming involved in your study?
Oh my. How often I needed to do it? What was, in my case, it was a shot. Finding out that I did need to wait an hour for it to be prepared. Gosh, I'm trying to remember.
Yeah, no, that's okay.
Just trying to get the details down of what were they looking for? What do I pay attention to? What are results that might happen? Just anything that would affect daily life.
Yeah. Debbie, what have you heard your patients ask about when considering a clinical trial?
A lot of our patients travel quite a distance, so Jen provides on some studies, like she'll call an Uber or Lyft to bring them to appointments. Do they have to pay for parking? Like what out-of-pocket expenses do they have? What's included in the study? A lot of the studies include the testing, the cost of the testing, so they don't have to pay for their echoes and right heart caths, and that's very important for some people who have some financial hardship. So that can be a benefit to some of the studies, but patients often ask that.
And Jen, sponsors can't pay patients or individuals to participate in trials, but what can they compensate for?
Yeah, and that's something we're always really clear with patients about is, we can't pay anybody for being in a clinical trial, but some do, like Tammy explained, some do offer like mileage reimbursement or travel, or a stipend for the visit, that patients may use to help with the cost of a meal or so on and so forth. But we typically, depending on the study, they're given a little card, and after their visit's completed, a dollar amount specified by the sponsor and such is loaded onto this card for them to use for whether they want to use it on the visit or whatever they may need.
That's very helpful. Thank you. So we've covered a lot of different aspects of becoming involved in research and using the NIH website, both in terms of maybe reminding you about questions to ask or things to consider becoming involved before becoming involved, and ways to search for specific trials. These resources will be provided to you, but we want to open it up to questions from the audience.
Yeah, so I'm going to go through any questions. I'll just read those off. So one that we have here is, can you guys hear me okay? Just making sure.
We can.
Okay, good. Okay, so the first one I have here is, do you know of any important trials recruiting patients currently?
Yeah. That's a great question, and it really is specific to the individual and the specific type of pulmonary hypertension. For example, sotatercept has kind of been, we've talked a lot about it today for pulmonary arterial hypertension, but we just completed our participation in a trial with sotatercept that expanded the investigation into patients that have both maybe pulmonary arterial hypertension, but also sort of a propensity to hold on to fluid due to other reasons. So I can't say there's one specific clinical trial that we have our eye on. But I'm just saying that there are even the big names in clinical research these days, even those are being expanded into other types of pulmonary hypertension. So it really depends on what pH group one has. It is such a broad question. I apologize.
No worries. We do have another question. What advice do you have for patients in clinical trial deserts where it may be more challenging to participate in a trial or study?
Yeah, Jen, we have some folks that travel quite a distance.
Yeah, we do have a patient that travels, and I think she maybe found the trial, and then reached out to our site about the trial.
Yeah, so I think that's where the NIH website is so helpful, and it really has to do with how far you can expand, your circle from where you live in terms of how far you're willing to drive. There are trials that will pay for flights, NIH trials, trials that are performed in Bethesda, sometimes will actually fly people in for various clinical trials. So I think that the best starting point would be to use the NIH website and just determine just how far you're willing to travel.
And you can still participate if you live far away by being in the registries, and because those are still very, very helpful. If you're not able to travel that far, nothing close to you.
Great, thank you. Another one we have is I am battling scleroderma, pulmonary arterial hypertension, and Sjögren's. I don't believe I'm pronouncing that correctly. But how do you decide which trials to even participate in when you have that many diagnoses?
That's a great question, because as we know, scleroderma affects so many different organ systems. Folks can have so many different complications from that connective tissue disease. Many times pulmonary arterial hypertension is only one of many serious conditions. They can also have interstitial lung disease. They can certainly have GI involvement, trouble swallowing pills because of esophageal issues. That is a really important question. We also know that scleroderma-associated pulmonary arterial hypertension is one of the most aggressive types of PAH. So Debbie and I care for folks with this condition every single day, and we are aggressive. push things, we push doses, we encourage people to participate in research. We now have 4 pillars of treatment. Used to be 3 up until about a year and a half ago, 2 years ago. We encourage people to be aggressive, not only in terms of those 4 pillars, but exploring other research options as well. So anything that is appealing to you, when you talk to your local team, we fully encourage you to participate. It can be very, very aggressive.
And the research coordinators have all the criteria, so they would be able to direct you as to whether you would qualify or not for each individual trial or what might be better for you. So they're a great resource.
So helpful. Looks like we have one for me. Okay, so can the Team Phenomenal Hope Unmet Needs Fund help pay for things that aren't covered for the clinical trials? So for those of you who don't know, Team Phenomenal Hope does have a financial assistance fund. Patients are eligible to apply to receive a grant of $500, and that money can go toward any non-medication cost. So you need groceries, it can cover that. If you need help with transportation to get to your appointments, it can pay for that. We've had patients in areas of natural disasters who needed emergency repairs to their homes, use the funds for that, repairs to the oxygen concentrator, and certainly these funds can pay for things that aren't covered by the clinical trial. So please take advantage. You can see on our website, teamph.org/unmet needs. You can see eligibility information there, and that fund does open on the first business day of each month. So really would encourage anyone living with pulmonary hypertension to take a look at that and really take advantage.
And that's $500 for the year, or
$500 for you can apply once a calendar year.
Okay. Mm-hmm. And it will apply towards transportation just to your regular PH office visits.
Certainly.
Because that's a huge need.
Yes. Put gas in the car. I've had someone reach out to me before who had a flat tire and wasn't able to drive their vehicle to their appointment. And so we approved their application and they were able to get a new tire to go to their appointments. So it can help in any of those ways. I encourage our providers to spread that information in their clinics. All patients should take a look and learn more and apply. So great question.
Mm-hmm.
It does look like we have one more. What is the usual length of time you would be involved in one research trial?
Jen, would you like to take that one?
So every trial's different. The sponsor defines the length of follow-up. I've had studies that may last for 30 days, or I have some that last 5 years. So it's very specific to the trial.
Okay, great. Panel, do we have anything else before we close out this evening?
Katie, I just want to thank you and Team Phenomenal Hope. What a great celebration of Pulmonary Hypertension Month, and thank you for these webcasts, and thank you for supporting all of our patients.
Yeah, thank you guys so much for being available tonight to answer these questions and go through this material. This is something that we get questions about all the time, so we are really happy to be able to talk about this, especially this month. It's so important to be able to talk about this month and raise more awareness and have more conversation. So thank you all very much, and thank everyone in the audience for being here. Thank you for your time. This was recorded, so we will be able to put it on our YouTube channel. probably next week. So you'll be able to access it again or share it with your fellow patients or your caregivers, your networks. That way we can get more questions answered too. So just a reminder, we did have other webinars in celebration of this month covering other topics that our community had questions on. And those recordings are live and up on our YouTube channel. Post this event, I'll be able to send out some information, some links that were provided in the slideshow. So I'll include some links to those webinar recordings as well, so you all have access. Yeah, I guess we can wrap up from there. Big shout out and thank you to our sponsors who helped us make this possible tonight. And again, thank you all for attending. So have a great night.
You too.
Thank you, everybody.